Hi, I'm Tony Preston here at the Asha School of Massage, taking you through range of motion testing. If you have your integrative craniosacral manual, there's detailed information about this. There are some pages like this that have small pictures that take you through the protocol in order, having a picture for each technique. There are also pictures like this that detail each technique, showing you a picture of the technique, talking about how to do the technique specifically, and which muscles are indicated by that technique. If you're not a body worker or therapist and don't understand appropriate cautions and contraindications, please don't do this. The first thing I'd like to talk about is how range of motion should be done in general. There should be a certain rate of movement that kind of matches the activities of daily living. If I move slowly through this range of motion, I'll bypass the nerve receptors that would normally stop the muscle from lengthening, and this ends up being a stretch exercise. The second thing that I like to say is that when I reach that end feel, it indicates what sort of problem we have. If I get a very hard end feel where it stops suddenly, it's usually an indicator that we have trigger points in the muscle that need to be released in order to lengthen the range of motion. If I take it and have a very soft, spongy end feel, it more indicates that there are collagen fibers that are restricting it and structural work needs to be done. Let's go through this in order. The first range of motion exercise is this one that I've been doing, which is for bilateral hamstrings. The toe is straight, the heel is straight, we pick up the leg at the normal rate of movement, and normally this should come so that the leg comes straight up and down. If I want to isolate lateral hamstring, I turn the heel out, the heel in, and the toe out, and I do the same range. Her lateral hamstrings are very short. If I want to test medial hamstrings, I turn the heel out and the toe in and do the same range of motion. Right about here, her knee begins to buckle, which is the end of range of motion for those medial hamstrings. The next test is for the long head of adductor longus and the medial hamstring. If I turn the heel out and take the leg here so that I'm headed toward the elbow, I bypass the hip. This is a good range of motion for this. If I turn the heel out and take the foot directly lateral from the body, this tests these middle bellies of adductor magnus and adductor brevis and adductor longus. I've gone around in a clock, kind of working through ranges of motion this way. If I step to the other side and hold this hip and come across, it tests for me the range of motion for the posterior fibers of glute medius and minimus. Normally this knee should come beyond this thigh. If I lift this leg and come straight across, I test the upper fibers of glute medius and minimus. And again, the knee should go past the opposite thigh. Just turn over. It's important that her head is straight during these exercises or it will change the range of motion here. If I take and bend the knee so that the heel comes toward the hip, I should be able to easily touch the hip with the heel. If this is short, it indicates the quadriceps. If it's short and the hip begins to turn and rise, it's more of an indicator of rectus femoris. If the hip does not turn and it stops short, it's more of an indicator of the vasti muscles. If I support her knee this way and place my hand here, I can test psoas and iliacus. As I lift, when the end of iliacus's range of motion comes, the hip will rotate anteriorly. When the end of psoas major is reached, the lumbars will begin to move anteriorly. If the knee begins to extend, it indicates rectus femoris. From this position, I can also test rotators. As I take this heel out, it tests lateral rotators. This is a good range of motion. And if I take this heel in, it tests medial rotators. Could you turn over for me? I can test different sections of those lateral and medial rotators when she's supine. If I bend her hip and knee at 90 degrees and take this heel out, it tests her lateral rotators, and this is a good range of motion at about 45 degrees. And if I take it in, it tests medial rotators, and again, this is a good range of motion at about 45 degrees. From here, I can also test glute max by taking this knee directly toward the opposite rib. Normally this should lay down a little bit further. This glute max is a little bit short. Okay, let's go through that entire protocol quickly and evaluate this side of her pelvis as I would in the beginning of a session. I can go here. There's her hamstring is short. Her medial hamstring is again short. It begins to buckle there. Lateral hamstring is very short. This is a good range of motion. This is a good range of motion. Good range of motion here. And here. Turn over for me. I can quickly test this quad, this psoas and iliacus, these lateral rotators, medial rotators. Turn back over for me. Lateral rotators, medial rotators, glute max. I can even run through the other side in just a second. Hamstring, much better hamstring range of motion over here. Lateral hamstring, stops a little bit short. Medial hamstring has a good range of motion, starts to move about right there. Adductor. Adductor longus. Great range of motion there. Posterior fibers of medius and minimus. Superior fibers of medius and minimus. Turn over for me. Quad. Psoas and iliacus. Lateral rotators. Medial rotators. Back those. And glute max. That's range of motion testing for the pelvis.